Health with secondopinion.org. Thank you for tuning us in today, and today we're going to be covering the merits of calcium, the forms in which you should buy it in, forms in which you should not buy it in, interactions with medications, and many other things today so that you get an understanding of when you go shopping for calcium, you know exactly what calcium to get, what it's supposed to do, the purpose in shopping for it in the first place, and its benefits. One of the first things that we try to cover on all of our sessions is the best form to buy calcium. The best form by far that we know of so far is a form called hydroxyapatite. You'll see it here on your screen, so don't get too confused about it, but hydroxyapatite is what I would consider the best form, also the most expensive form. Good forms that you can buy it in, so you can look at your bottles and see what you have, is citrate, gluconate, and aspartate. Okay, the poor forms, the poor quality forms, are carbonate and lactate. Unfortunately, a majority of forms are actually in that form, carbonate and lactate, but they're the hardest to absorb in many cases and can be hard on the stomach. The form it comes in may make all the difference in absorption and use in the body. If it doesn't get into the body, it doesn't matter how much you take. So bottom line is, you can't just overdose on it and think you're going to get plenty. The body will not respond in the way that you think, okay? So the American way as to, well, if a little's good, a lot's even better, doesn't work well. And one of the things you have to know is calcium works with certain synergists, and magnesium and vitamin D should be with your calcium at the same time so you don't create other problems. We'll explain that in just a little bit. Unfortunately, in every industry there's dirty little secrets, and this is one of them in the mineral area. When purchasing any mineral, you must find out the total amount of the element you want and not just the total complex number. In other words, it says, let's say calcium carbonate, okay? If it says 1,000 milligrams of calcium carbonate, you perceive that the idea is, I've got plenty of calcium in there. Well, the truth is, 60% of it's probably carbonate and only 40% of it's calcium if you absorb it in the first place. So the bottom line is, unless you know what's in the bottle, and it actually states it's one of the things that is not mandated, is that it does not have to state that it has 1,000 milligrams of calcium in it. Now, nothing that you'll ever purchase through us will actually have it marked any other way. It will actually be separated out so you know how much you're buying of calcium, magnesium, or any of the other vitamins or minerals or anything else that we actually carry at secondopinion.org. But the reason I mention this is simply, unless it's stated that it's calcium by itself, the amount of calcium in it, you have no idea. You literally could be buying 1,000 milligrams of calcium something, okay, the carrier, and unfortunately only end up with 100 milligrams of calcium, think you were doing the right thing for many, many years, and end up with minimal value for yourself, your health, and your well-being. And ladies, when it comes to calcium, it's such an important issue, you cannot make a mistake in this area. So magnesium, just so you know, you need to watch out for a few things when it comes to calcium. Magnesium should be taken with calcium at about half the dose. So if you're taking 1,000 milligrams of calcium, you know it's really 1,000 milligrams. You need to take about 500 milligrams of magnesium or you'll create an imbalance in that area also. The reason why is you create a magnesium deficiency, you'll create all kinds of other problems. And make sure you pick up our magnesium session. You'll actually find out that there's lots of really key benefits to magnesium. And if you take too much calcium without magnesium, guess what? It's an issue. Vitamin D is a mandate to have with calcium. So if you got calcium by itself, no vitamin D whatsoever to help its absorption into the body, not that it's useless, but its benefits wane greatly, okay? When you use this nutrient for a long period of time, I recommend that you try to do it as a general mineral formulation. It's one of the things that we carry, and the reason why is because long-term use, you can create other problems by taking too much of one element. Now, sometimes it's very frustrating, isn't it? I don't know how much I should take, and then how long I should take it, and how long I should just take this and that. That is the reason for these sessions. It is to try to help you learn how to do it correctly and do it long term and reap great benefits from it and save the quality of your life. Bottom line, if you've not tuned in Secrets of Vital Health, that is at secondopinion.org or at Physicians Premium, please do, because once you get an idea of what's going on food-wise, our general health, and that probably these nutrients and poor quality diets are probably the primary reason you feel like you do, it'll motivate you to want to learn these things. And that's the reason for me putting these kind of sessions on video for you to pull down. Now, just to understand a mineral. Mineral is an organic substance that is vital for your life. Majority of minerals cannot be synthesized in the body, thus the diet or supplementation must supply the needed amount. Again, if you look at Secrets of Vital Health, you'll know that why the diet, more than likely, if you're eating what we produce in the United States of America, is probably not going to produce enough. So, when we look at synthetic and natural forms, okay, remember I said over a period of time you want to take the mineral as a complex. The reason why is because over a period of time, if you are just taking one element too long, you'll create problems elsewhere. And remember, those synergists, those things that help your brother get on into your system so that it functions well, is important. And the synergist list in calcium alone should make you understand that a general multiple vitamin with a general multiple mineral assist is probably a mandate in these cases, because over a period of time, it by itself is not the best choice. Okay, it's better than nothing, but not the best choice. Sometimes getting anybody to do anything is the first thing. The thing I'm trying to do is get you to do what's good for you, beneficial, and actually is going to make a difference in the long term. Here's the synergist list: magnesium, manganese, boron, which if you have osteoporosis, the tendency towards, or you're trying to prevent it, boron is a big deal. If you've not picked up our seminar on osteoporosis, do, because you'll understand why these are important. Essential fatty acids, fish oils, flaxseed oil, phosphorus, which is plenty in our diet, lysine, a special protein, vitamins A, C, D, and E, cobalt, which is very, very small amounts. You don't need to take much. Folic acid, which you've heard probably a lot about, iron, and zinc. Okay? I let you look at this just because broccoli, I put it up there for one reason. Look at all these elements. If you're waiting for us to do all the research to find out what all these elements are in broccoli and why eating broccoli or eating an apple, which has even more elements in it, in its organic state, why it makes a big difference. Well, here's the why. It's just got an inordinate amount of minerals and vitamins and lots of other things mixed together that make them healthy. And for those out there that, oh, gee, I don't eat vegetables. Oh, and gee, I don't eat fruits. Guess what? You might not eat them, but you're going to suffer illnesses that you might not have to suffer from, or general symptoms that you shouldn't have to suffer from because you choose not to, because there's no way myself or any other expert in this field is going to be able to make a formulation that's going to suffice everything that's in an apple. So make sure you know that, okay? So what are some of the things that this nutrient can help that's really important? Broken bones. Helps them heal faster. Helps them heal more completely. Bone strength. Teeth. High blood pressure, by the way. High LDLs or low HDLs. Remember, we want them in the opposite way. Calcium plays a role there. High cholesterol. Gingivitis. Okay, in the gums of the teeth. Muscle, tendon, ligament strength and tone. Kidney stones. And by the way, for those that have kidney stones, the idea that just taking a moderate amount of calcium is causing the kidney stone is completely a farce. There's no research supporting that. However, taking an inordinate amount could play a role. Migraine headaches, osteoporosis, pregnancy, need more calcium, premenstrual syndrome, calcium, magnesium, B6. It's a remarkable turnaround many times in premenstrual syndrome symptoms, and of course rickets. Food sources, dairy, milk, cheese, etc. Sardines, salmon, green leafy vegetables, tofu, carob, by the way, for you chocolate lovers that you know eating all that chocolate is not the best thing in the world. Guess what? Carob could be bailing you out of it and giving you lots of calcium as well as some other good elements. Almonds, kale, and oats, which should be part of that breakfast, mostly if you have a cholesterol problem. The risk groups that we need to look at: children with poor diets. The amount of children I get in the office now with symptoms that end up being a dietary issue is unbelievable. I mean, I just can't tell you, you got to do something about it. People with darker skin have a tendency towards calcium deficiency. Vegetarians, true vegans, have problems with calcium deficiencies. People who live in northern climates have a tendency. Why? Vitamin D is converted when you hit sunlight into an active form that helps you absorb calcium. Okay, remember, sunlight, vitamin D, more calcium. Northern climates have minimal sun, minimal vitamin D, and reduced calcium, just so you know. Okay? People who stay inside all the time, you don't go outside, you don't get any sunshine. It's detrimental to your calcium balance and your bone structure. And most people that, frankly, in the United States of America at least, are well below the calcium needs. So the idea of supplementing calcium is almost a must in most cases. Women, absolutely. Men, more than likely. So just so you know. Let me give you a picture here. If you look at the bone structure of the body, it's basically 99% of all your calcium stored there, in your teeth and your bones. Here's the issue. When we do a blood draw and we find out your calcium levels are reasonably normal, and gee, the doc said my calcium levels were fine. Let me tell you, almost, I don't want to say it's a useless test, it's a minimally beneficial test to know whether you're calcium deficient or not. Why? Because when your body needs calcium, a hormone called parathyroid or parathormone actually is secreted and leaches calcium off of your bones into your bloodstream to keep it balanced. Because if calcium's not in your bloodstream and it's not in your cells, you'll end up cramping, might even have heart conditions and other things that could create major severe health conditions. So when it's low, guess where it goes? To bone to get it. Now, if you're not taking enough in and you keep that balance, which by the way is common, if you're a soda drinker, a heavy coffee drinker, or a poor diet person, let me tell you, you're just leaching, and it is not going to, we're not going to come up with some miracle cure, folks. Once you lose that bone mass, mostly ladies after you're 16 to 21 years old, you're not going to replace that bone. And if you do, it's going to be minimal amounts in comparison to the needs that you have. Again, the osteoporosis seminar is very, very helpful. So, realize calcium keeps leaching, and if you don't balance it on a daily basis, not just whenever you get a chance and you think about it, you're going to end up leaching enough calcium off that we're going to see osteoporosis in the next 20 to 30 years to be a devastating disease, which it already is cost-wise in this country. Toxicity is very rare. Can it happen? In these special conditions, sarcoidosis, hyperparathyroidism, okay, we actually have a disease process, chronic kidney disease, and people with recurrent kidney stones should stay on lower doses of calcium, not necessarily stay away from them. Absorption is blocked by too many other minerals without enough calcium, and there are certain medications that do interact. This is a general idea on your medications. Just realize it's not a complete list, but let me tell you, it gives you a good idea of how it interferes, and if you're on these medications consistently, how much interference might be occurring to your calcium. Guess what? Osteoporosis medications interfere with calcium absorption and utilization. It's the very thing that you think should be layering more and more calcium on your bone. It does, but through a different way, and it's not very healthy. Aluminum-based medications, or aluminum that's in your antiperspirants that you put in your arm to make sure you don't smell or you don't sweat. I use anti-deodorants, but never antiperspirants, because the majority of them have aluminum. And just for you ladies, if it has aluminum and is absorbed, people that use those types of underarm roll-ons have a slightly higher incidence of breast cancer. So that's really important for you to know too. Sinus medications, how many of you are on asthma and sinus medications have been for a long period of time? Calcium is being sacrificed. Cholesterol lowering medications, why? Vitamin D isn't absorbed, you can't absorb calcium, you're in trouble. Longer you're on it, the more problems we're going to have in other areas. Gee, what do I do? Well, you get healthy and you eat right and you take responsibility for your health and you start exercising and reduce your stress, and your doctor probably won't mind lowering your cholesterol medication if in fact your cholesterol comes down because you're taking care of it, because it can be done. I've seen it all too many times. Don't be misled that you can't do anything about it, because that is not true. Cortisone medication. Antacid medication. You lower the acid level in your stomach to a point where you can't break down calcium to be able to get it absorbed, because basically, remember, it is a mineral. It has to be broken down into small pieces so your body can absorb it. If you're on antacids all the time, guess what? Okay? Anti-inflammatories, chronic use of them, an issue. Antivirals, HIV drugs, or things like that, or those that are using for herpes around the mouth or genital can be an issue. And anticoagulants such as heparin, okay? Hydrocortisone, again for asthma or skin conditions that the doc always gives you it, prednisone, and sodium phosphates or bicarbonates. That's a medication interaction list, a long one in this case. It isn't in all cases, but it is in this case. Recommended RDA dose, remember, recommended daily allowance. That means that it barely keeps you alive, it doesn't make you thrive. If you haven't seen our Secrets of Vital Health, please get it, copy it, get it to other friends, and start saving lives. Because RDAs are too low in most cases, not all, but most cases, just so you know. Remember, RDAs were set to keep you alive. They weren't set on a level to give you optimal health. Keep that in mind. Men and women, 1,000 to 1,500 milligrams per day. Diet is the way to get it. If you can't supplement, is the next step. The truth is, most of you will need to supplement. Bones and teeth. Dr. Benzinger's advanced information starts off with bones and teeth. 99% of all calcium is stored here and acts as a bank to be used, okay? We've talked about that. Over 20 million already suffer from osteoporosis, and it's going to get worse if we continue doing the habits that we're doing in this country. And women stop forming bone in their early 20s, so guess what? You don't get the bone, if you don't get to your kids now and start dosing them, and you don't get their diets straightened out, let me tell you, you're going to feel really bad as a grandparent when they start suffering, because it is going to happen. It is statistically impossible for it not to happen. Does it happen in every case? No, but in a lot of cases, it's going to be concerning for all of us, okay? The other advanced information is on hypertension, okay? Combination of high sodium and low calcium has been directly implicated into high blood pressure. If you didn't have to take high blood pressure medication the rest of your life, wouldn't that be nice? If you got your calcium balance up and kept your sodium down by following the DASH diet, DASH diet. If you've not seen our high blood pressure seminar, it talks about that in detail. Okay? Calcium magnesium in combination has been shown to be a powerful 1-2 punch. I mean, it's dynamic. Just adding these things is really helpful. Give you a short story. Go into emergency room with really high hypertension, okay? Or just a reaction to something, your blood pressure is really high. Guess what's one of the things that they will try when other things fail? IV, intravenous magnesium, because it almost always works. That's what I was told by 2 ER docs in 2 different places in 2 different cities, said, gee, IV magnesium almost always works. Isn't that interesting? Okay, so why wouldn't you be recommended higher doses of magnesium with a balance of calcium and some vitamin D for health's sake, and maybe help lower that blood pressure without medications? Side effects of medications? Well documented. The other advanced information on colon cancer. There's a lot of articles that have already indicated that colon cancer have been frequently shown with lower levels of calcium in the body. Okay, the lower the calcium gets, the more tendency towards colon cancer. Remember, blood tests don't really tell us a whole lot of in the cell calcium levels. Several other studies, one has already demonstrated beyond a shadow of a doubt that with calcium, whenever somebody has been diagnosed with colon cancer, their levels of calcium are noticeably lower in the cell on a consistent basis. Problem is, many times they don't measure intracellular calcium and many times miss this information. We've already mentioned in our advanced information prior to this, osteoporosis and calcium deficiency have a direct relationship, and maintaining it using calcium, vitamin D, magnesium, boron, and zinc lowers the incidence of osteoporosis in multiple studies, okay? Lastly, the premenstrual syndrome is a big deal. Calcium has been demonstrated in numerous studies to help reduce PMS. Wouldn't that be wonderful? You know how many ladies start with this and they're 13, 14, 15, 16 years old, and many deal with it all the way into their 40s or 50s? Worth it. And guess what? If you then combine it with magnesium, B-complex, primrose oil, and vitamin E and A, and when they're added, there's substantial improvements, and has been documented in multiple studies also. Why not try that? Here's what's also interesting. Those with PMS and drank coffee every morning had much greater symptoms than those that did not. And by the way, infertility goes up the more caffeine you drink. Some of the general studies show that too. So maybe there's an interrelationship. Hey, getting up in the morning and having 1 cup of coffee is not the issue, is it? It's getting up in the morning and having your half a pot and then 1 for lunch and then drinking your diet sodas that have heavy caffeine and green teas and blah, 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 and iced tea all day long. That could be an issue. So to recap Dr. Benzinger's possible benefits of calcium: helps broken bones, helps bone strength and teeth, high blood pressure, high LDLs, helps lower them and helps elevate HDLs, high cholesterol, gingivitis, muscle, tendon, and ligament issues, soreness, stiffness, fibromyalgia symptoms, even though magnesium is more isolated for that, kidney stones, migraine headaches, osteoporosis, pregnancy, Premenstrual syndrome, go after that one, folks. And of course, rickets. Hopefully, calcium now has a different picture. Its value is amazing. Understanding that the blood test probably isn't going to tell you that you have a problem is an amazing issue. And understanding the types that you should be purchasing them in for your health's sake is important. And the dirty little secret on minerals, you might look at it and just know that more than likely when you bought it for that inexpensive price, and it's got all these dyes and binders and everything else, the likelihood is the amount of calcium and quality calcium is not there that you thought it was, and you've been deficient all this time. And many times I get people say, yeah, I've been doing all this for all these years, and it just doesn't seem to help, and I put them on things that we carry because we have to carry therapeutic support, nutrition, and you'll never see anything different on our Second Opinion or our Physicians Premium site. You will never see anything different than that. The reason why is because people are too valuable to be taking chances for profitability. We've got to do what's right by you, okay? And we will continue to do that. That is my word. This is secondopinion.org, and this is Dr. Sean Benzinger from secondopinion.org trying to do something right by you. And we hope that this is beneficial. Look for our other seminars that'll be coming out and information on minerals, vitamins, and all kinds of things so you start getting to products that actually work for your best benefit. We'll look for you next time. May God bless you.